Dr. Eric Presser is a leading thoracic surgeon in Palm Springs, California, who specializes in the treatment of cancers of the chest. He is also the author of a new book, An Empowering Guide to Lung Cancer: 6 Steps to Take Charge of Your Care and Your Life. His book teaches the value of investing in your health with lifestyle choices that can help kick habits that increase your cancer risk. Dr. Presser talks about why he wrote his book and what can lead to an increased risk of cancer.
Cancer is the uncontrolled growth of abnormal cells someplace in the body. Our cells are constantly dividing, and what happens with cancer is all of a sudden you get a small mutation. And we know that there are certain substances, toxic substances, that can cause these mutations. We also know that genetics play a significant factor. When we see that person who never smoked, but everyone in their family had cancer, for example, we know that there's a genetic component. So what I tell my patients is that we're all most likely prone to some kind of cancer, but by smoking or being exposed to certain toxic substances, it revs up the process. The fact that we have lung cancer screening now is a step. That's all it is. We're trying to take the high-risk group and start with them. But we need more education. We need people to understand that lung cancer is the #1 cancer killer in the United States and the world. So if 15 to 20% of people get lung cancer who never smoked, we need to keep asking why. We need more attention to research, and we need more attention to screening and catching this killer earlier. The reason why I wrote my book, which is entitled An Empowering Guide to Lung Cancer, was to educate not just patients, but physicians on all of the nuances surrounding lung cancer screening, and most importantly, minimally invasive chest surgery. Minimally invasive chest surgery gives us so many more options in diagnosing and subsequently treating lung cancer. Lung cancer is devastating because the body is so resilient that by the time lung cancer symptoms arise, it's usually too late. What that means is that by the time you're having shortness of breath, coughing up blood, having some chest pain, the cancer is usually at a later stage, which means that your chance for survival and cure are decreased. There's about a 1 in 17 chance that you will get lung cancer during your lifetime. That goes down to 1 in 6 if you're a smoker. It's actually a 20% increase in getting lung cancer if you live with a smoker from secondhand smoke, and many people don't realize that. So how deadly is lung cancer? Right now, it's extremely deadly. There's only a 15% 5-year survival rate.
Rates of lung cancer in men or women have changed over time.
Whether you're a man or a woman, you're equally prone to obtaining lung cancer. Back when the GIs came home from the wars and cigarettes were very popular, of course we saw a spike in men getting lung cancer. But as women are growing older and it became more glamorous in the 1970s and 80s, more women are getting lung cancer. So no, it doesn't play favorites.
Coming next, do you know the symptoms of lung cancer? For a consultation with Dr. Presser, call 760-424-8224. Dr. Eric Presser discusses the symptoms of lung cancer and the importance of lung cancer screening to detect any problems.
Some of the symptoms of lung cancer are cough, whether it's chronic, whether it's persistent, whether you're coughing up blood, coughing up sputum. You could feel chest pain or pressure in your chest. You could also feel as if you're suffocating. But most of the time, these signs and symptoms are found in the later stages. Our body is so resilient. And if I tell you the importance of screening is to find these cancers when they are 8 millimeters, 1 centimeter, that's less than the size of a quarter. That's because they're not causing any symptoms. But yet we have the option to resect for cure. Now, it doesn't mean that if you have a cough or you're coughing up blood that you should panic and you have lung cancer. But it definitely means that you should get it checked out. You should absolutely 100% see your doctor, and if the symptoms persist and you're not happy with the progression of care, then you get a CAT scan. It's that simple. A CAT scan gives us so much more information than a chest x-ray. Many patients and physicians alike do not realize that insurance will cover a screening CAT scan of the chest if you are between the ages of 55 and 77 and smoked a pack of cigarettes a day for 30 years or 2 packs a day for 15 years and are an active smoker or quit smoking within the last 15 years. That's the criteria that we have now. The importance of screening is to catch lung cancer early. With 85% of lung cancers diagnosed at a later stage, we need to do better. We need to catch this killer earlier. And right now, we do not have a blood test. We do not have any other test other than imaging to show if there is some kind of abnormality within the chest that needs to either be removed or watched. If you're an active smoker, I highly recommend that you get your CAT scan of the chest as soon as possible. And make sure that you follow up year after year as per the recommendations. Not every mass or spot will be a cancer, but if it is, and we catch it early, then it increases the chance for cure dramatically.
Coming up, stopping smoking is crucial to your health and your lifespan. Smoking kills almost 500,000 Americans each year, with more than 40,000 of these deaths from exposure to secondhand smoke. We asked Dr. Presser if smoking anything is safe.
Any kind of smoke that enters through your lips is bad. We all know that there is a definite correlation between smoking and lung cancer. 1 in 6 smokers will get lung cancer. That's a fact. Wanting to quit is the first step. It's very difficult to quit. Smoking affects every organ system, not just our lungs, but our circulation, our skin. By the time you quit smoking, you can actually see an effect a week or 2 later. There are studies that show that when I'm going to operate on somebody, that if they quit smoking and we operate on them 2 weeks later, that it decreases their chance of getting a postoperative pneumonia just from those 2 weeks of not smoking. But don't think that just because you have lung cancer, you shouldn't quit. But more importantly, if you don't have lung cancer and you're a smoker, you need to quit. It's very difficult to quit. Nicotine is a very addictive drug.
There are methods to help people stop smoking.
There are drugs out there, everyone knows Chantix, and it actually manipulates the neurotransmitters in our brain. Whenever someone has a cigarette, it triggers neurotransmitters that make you feel good. And that's what Chantix does. It duplicates the feeling that you get from the nicotine rushing into your blood system. What most people don't understand is that there's a severe and significant oral fixation. Smokers love to have something in their mouth. What I've told many of my patients after they've tried everything is to get a bag of lollipops. The lollipops take care of the oral fixation, and I tell them to get a nicotine patch. And the nicotine patch takes care of the nicotine that their body is craving. I then tell them to take a picture of their loved one and put it in their wallet. And every time they go to reach for a cigarette, reach for a lollipop, and take out that picture. Because smokers live 14 years less than non-smokers. And you should see the look on my patients' faces when I ask them if they want to see their children grow up, or if they want to see their kids graduate from college or get married. They look at me like I'm crazy. Of course they do. I ask them why they're smoking then. Because if I gave you a knife or a cigarette, you choose the cigarette, but they're doing the same thing.
Is vaping safer than regular cigarette smoking?
Don't do either one. We know what smoking does, and the verdict is still out on vaping. We know what goes into the cigarette. We know what comes out of the cigarette. We know about the statistics relating lung cancer to cigarettes. We also know that radon, asbestos, a lot of different things cause lung cancer. As a physician and a thoracic surgeon, I cannot help but tell anyone, do not put anything into your mouth that goes into your lungs that's not supposed to be there.
Patients sometimes need to understand how smoking affects their family before they are able to quit.
One of the most memorable patients I have was a ex-NFL athlete, and he smoked. And he smoked while he was in the NFL. And what's amazing is that he went to his doctor, he had an x-ray which showed a spot and a subsequent CAT scan which showed a suspicious lesion. And he was sent to me to discuss what the options were. We decided to take it out, and it was a lung cancer. And I did a proper cancer operation, and he was out of the hospital within a day or two, and he was back to his normal routine. But what's amazing is that up until the operation, he told me he was never going to be able to stop smoking. And I said, but you have lung cancer. We know you have lung cancer. What's it going to take? He said, I don't know, but I can't stop smoking. Well, let me tell you, those 2 days after the operation in the hospital, he stopped smoking. When he went home, his wife and his children got on him and said, are you crazy? Stop smoking. He threw away his packs. He never went back. And when I saw him at the 2-week follow-up, not only did he thank me for taking out his lung cancer and ultimately resecting for cure and saving his life, but he thanked me for being persistent by insisting that he would quit smoking, because he knew that it was so bad for him, but yet he kept doing it. So in essence, he was scared straight, and it worked.
Up next, the advantages of undergoing minimally invasive surgery. For a consultation with Dr. Presser, call 760-424-8224. Minimally invasive surgery has become an important part of treating lung cancer patients, helping them recover faster with less pain. Dr. Eric Presser gives us a patient's story.
I recently saw a patient in the office who has breast cancer, and on one of her follow-up PET scans, they found a single mass in her lung. Now, her oncologist, who I've been working with for years, knows that minimally invasive chest surgery can come into play because I can go in there and resect this mass. No matter what it is, we will have plenty of tissue for diagnosis, and it will be taken out completely. So in this case, it's the best option for this patient, considering she'll come in, she'll have the mass removed, and she'll go home the next day.
What are some of the advantages of using minimally invasive surgery?
Minimally invasive chest surgery means that I'm using 1 centimeter incisions to perform the operations. I perform operations using 1 incision. I call it single incision VATS, or video assisted thoracic surgery, to 3 or 4 incisions, depending on how extensive the operation is. Every surgery is different. I use as many small incisions as necessary to perform the operation at hand. Now, I can and am able to make larger incisions, but I know how devastating that is on the patient. When we have to crack ribs and make large incisions, it puts the body under a significant amount of stress. By using small incisions, the body is under less stress, which means that you have less pain, less hospital time, and you get back to your normal routine quicker. I had a patient who was in a car accident. He presented to the emergency room after the airbag deployed, and he was complaining of chest pain. They did a CAT scan of the chest. Everything was fine except they found a mass. Now, this gentleman was about 70 years old. He smoked, and he was quite concerned. So they sent him to me, and I saw him in the office. In the office, we looked at the images together. There were some suspicious findings. So I offered him all of the options, from observation to resection. He told me he wouldn't sleep at night unless he knew exactly what was going on. So I resected the mass. While he was asleep in the operating room, I sent it to the pathologist. The pathologist was able to tell me if it's cancer, and I then proceeded with a formal, proper cancer operation by resecting the mass, the remaining lobe, and the surrounding lymph nodes. The patient was out of the hospital in 2 days. He was back to his normal way of life that week, and he was able to follow up with an oncologist and start treatment in this case because his incisions had already healed. It's amazing what we can do nowadays using minimally invasive surgery.
Dr. Presser discusses alternative therapies for treatment.
Not a day goes by where someone doesn't approach me and ask about alternative therapies. I always stick to the same basic facts, which is diet, exercise, eat right, don't do anything in excess. When people ask me about superfoods or antioxidants or any of these supplements, there isn't enough information out there to really hang our hat on something, but it really depends on the patient. For example, I had a 34-year-old gentleman who was a smoker, who was unfortunately diagnosed with metastatic lung cancer. I did everything I could to make him comfortable, meaning I couldn't resect his lung cancer for cure, but his chest cavity kept filling up with fluid, and there are other procedures that I can do that allow him to be more comfortable. When he came to my office one day holding a bag full of supplements and antioxidants and asking me about all these therapies, I just looked at him and I said, go ahead. You're able to do whatever it is that makes you feel better. And in this case, I had no evidence that said what he was doing was going to be more detrimental. 34 years old and had lung cancer. So anything that he wanted to do or anything that he did to give himself hope, I wasn't about to take that away. I will never take away someone's hope. And in this case, because he actually felt better, he could breathe better, and he had hope, he lived longer than the average person would under the circumstances.
Up next, how the patient, their family, friends, and the doctor work together for the best outcome. For a consultation with Dr. Presser, call 760-424-8224. When facing a diagnosis of lung cancer or any serious condition, allowing support from family and friends can help relieve some of the stress. Dr. Eric Presser recommends that a good surgeon is also a teacher, helping to guide the patient through their cancer journey.
If you are ever unfortunately diagnosed with lung cancer, make sure you involve as much of your family as possible. People think they're protecting their loved ones, but in actuality, in the long run, you need them. You need their love, you need their support. In my book, I mention a story about my own father who went on a business trip, or so I thought, and I received a phone call a few days later that he had open heart surgery. And I flew on the first plane back to New York, and I was angry. I was happy that he was alive, but I was very angry that he didn't allow me the opportunity to partake in the situation, because the first thought in my brain was, what if I never saw him again? I never had an opportunity to say goodbye. The point I was making is, make sure that you don't keep secrets. Make sure that you allow people to love you, to help you. Make sure that you have all the shoulders that you need to lean on. Don't isolate anybody.
Empathy with the patient and their family is an important part of the surgeon's work.
When I have to walk out of the operating room and tell a family that we found cancer, it's one of the most difficult things to do, because you know that you just changed not just the patient's life, but everyone in their family's life as well. It's devastating. But a good surgeon, a good doctor, tries to show not just compassion, but also empathy. And if they can see it in your face, that you are actually on their team, that you actually care, that you're actually part of them, that you have their back, then they know that moving forward, you're going to take a difficult situation and make it as simple and pleasant as possible.
A detailed plan of options to treat cancer helps to empower the patient.
So what I tell all my patients is we have to attack every situation in a step-by-step fashion. After an operation, the next step is getting the patient out of the hospital. Most important, because if you don't get the patient out of the hospital, there is no further treatment. So once the patient's out of the hospital, then you guide them. You make sure they see the proper oncologist. You make sure that they follow up with their other doctors. You make sure that they tell their family. You make sure that their support system is available and that everyone understands what the next steps are. It's overwhelming. Cancer is overwhelming. And that's why many patients need a guide. It's another reason why I wrote my book, An Empowering Guide to Lung Cancer. If you follow the 6 steps, it actually will guide you through this devastating course that you didn't ask for. And it's not just about lung cancer. If you actually read steps 4, 5, and 6, they apply to anyone with cancer.
Coming next, how the surgeon helps patients and their families understand the best options. In Dr. Eric Presser's book, An Empowering Guide to Lung Cancer, there are 6 steps to take charge of your care and your life. Increase awareness. Get a proper diagnosis. Know your options. Ask the right questions. Remove toxic substances from your life, and acceptance. Dr. Presser shares another patient's story and another reason why he wrote his book.
Because I'm based out of Palm Springs in California, I see patients from all over the country and all over the world. I recently saw a patient who was treated in Washington State for her lung cancer. Unfortunately, she's in the later stages and her chest keeps filling up with fluid. They drained her chest over 12 times with a needle. And when she came to see me, I offered her a procedure that I do, which took care of her problem once and for all. When she asked me how come no one else offered her this procedure, I said, I don't know. But it's one of the reasons why I wrote my book.
Patients need information for the best choices in treating their cancer and having the best quality of life they can have.
Not everything is curable. Not every cancer is curable. But every cancer is treatable. And that's what I make sure to tell all my patients. They need hope. They want to know that everything that can be done will be done until it's time for them to stop. Everyone says you have to fight cancer, you have to fight cancer. Well, sometimes you want to stop fighting cancer, and that's okay also. So my job as a surgeon and a physician is to make sure that the patient and their family know what the best options are and also what they can and can't do throughout their journey.
Dr. Presser reveals that establishing a personal bond with patients is a key part of being a good doctor.
I was recently treating a patient and I was explaining to him what the options are. And when I told him that I would treat him as if he was my family, as if he was my brother, and I asked him to decide and let me know. We ended up performing the operation. He did very well. But afterwards, he looked me in the eye and he said, you didn't have to convince me about what needed to be done. But when you told me that you would treat me as if I was your own family member, as if I was your brother, I knew that I was going to be in good hands. So being a good doctor is not just wanting to know what you need to do. And being a good surgeon is about having a proper plan and execution. But many times, you have to gain the trust of the patient. It's a privilege to operate on somebody. And I make sure that I relay that to all my patients every day. And the day that I walk into the hospital and I don't feel that way, I'm going to quit.
For a consultation with Dr. Presser, call 760-424-8224. Medical marijuana is becoming more accepted as a therapy for controlling pain and many other indications. But should you smoke it? Thoracic surgeon Dr. Eric Presser gives us his advice on using cannabis.
Almost on a daily basis, I get the question of whether or not they should smoke or vape cannabis or marijuana. And I will tell everyone the same thing. You should not be inhaling anything into your lungs. And nowadays, we need much more research on cannabis because there is a lot more to it than just THC and doing it for recreational use to get high. The cause and effect of the CBD and the cannabinoids that we now know are going to open up a tremendous amount of education and research in the field of medicine, and hopefully it will help take care of a lot of the diseases that we don't have a cure for, or at least we cannot control the symptoms of, starting with chronic pain and ending with diseases like muscular dystrophy, epilepsy, and so on.
Vaping may be a safer option for the health of your lungs.
Whenever someone comes into my office and I ask them about marijuana smoking, because it is legal now here in California, I always tell them that if they are combusting a marijuana cigarette or a joint, that they should try to vape it instead. They look at me funny, but I then explain to them that there are electron micrographs that actually show that when you vape cannabis, it actually leaves behind a lot of the garbage that you don't want to inhale into your body. The example I give anybody is when you go to a campfire. You cannot put your face over the actual campfire, and there's nothing more organic than that. You have a log that you found in the forest and you have fire. But because the fire is combusting everything in that log, you're breathing in everything. By vaping cannabis, you're actually leaving behind some of the garbage, some of the dirt, if you will, and it actually gives you a cleaner high or a cleaner way of delivery. Now, it doesn't mean that I am promoting that anyone should be smoking anything, because it does create and cause the inflammatory response. But if you're going to, then why not do it to the best of your ability? And beyond that, I always tell them, why don't they try edibles and oils? Because obviously with edibles and oils, you're not creating that inflammatory response. You're not inhaling anything that's going to cause or be detrimental to lung health.
Dr. Presser tells a patient's story about cannabis for pain control.
I had a patient recently who came to me who was diagnosed with cancer. And she told me that she got her hands on some CBD oil and she tried it for the first time. And this is a person who needs anxiety medicine to go to sleep, and she has chronic pain, not just arthritic pain, but now pain from her cancer. And she pulled out this little vial from her purse, which you can get legally now, and she showed me exactly how much she now takes before she goes to bed. And I was amazed as she explained to me that not only does it help her fall asleep without any of her other medications that were helping her with her anxiety, but the next day she can function like a human being and not take any anti-inflammatories, any narcotics, and she is essentially pain-free.
Coming next, you've heard about the real dangers of secondhand smoke, but what about third-hand smoke? For a consultation with Dr. Presser, call 760-424-8224. Everyone knows the risks of cigarette smoking. It's the cause of almost 500,000 deaths each year in the United States. 40,000 of these deaths are attributed to exposure to secondhand smoke. But do you know what third-hand smoke is? Thoracic surgeon and author of the book, An Empowering Guide to Lung Cancer, Dr. Eric Presser discusses the most recent findings into the dangers of third-hand smoke.
Third-hand smoke is the toxic cocktail left behind on the surfaces and objects that come in contact with secondhand smoke. Secondhand smoke is the smoke and the toxins that come out of the smoker's mouth and the smoke and the toxins that come off the end of the cigarette. So third-hand smoke are the compounds that are left behind in carpet, curtains, furniture, hair, skin, so on and so forth. And the problem with third-hand smoke is that we are just learning about the detrimental effects that it can have, especially in children.
Dr. Presser discusses some of the health hazards of exposure to these toxins.
So for example, with children who are exposed to secondhand smoke, we have good reports about what it can do. Now we're learning that third-hand smoke, the toxins that are left behind that coat these surfaces and objects, need to be dealt with. It's very difficult when you have a toddler, for example, who runs around all day and all they do is put their hands in their mouth or they eat pieces of carpet. And what we now know is that the toxins from the cigarette smoke are embedded in these objects and materials. Another important example is when you have a family member that smokes outside. Even when people smoke outside and when they come inside, you know you have that smell. Well, if you have a little guy who wants to jump up on their lap and read a story, you're exposing them to these toxins in the third-hand smoke, in the chemicals that are actually left behind that you can find on the smoker's clothes and hair and even their skin. You see, third-hand smoke, just like second-hand smoke, can be absorbed, ingested, or inhaled. One of the problems is that we know that second-hand smoke can cause upper respiratory symptoms, early asthma, cognitive and developmental delays in children. And what we are learning is that these same toxins are in actuality in third-hand smoke, and people need to give it more attention. But the levels that they're finding that are found in these toxins that are left behind on these surfaces and objects called the third-hand smoke are actually detrimental and can cause long-term effects.
Dr. Presser shares a story about third-hand smoke.
Recently, I took my family on vacation to Las Vegas, and we figured we'd see some shows, and we stayed in a very nice room, and the problem was we booked a non-smoking room. When we got there, we were told that it was a smoking optional room. And when we went to go smell the furniture and the curtains and even the carpet, it was as if someone just lit up a cigarette right in there in front of us. So when I called down and I complained and they could not accommodate me, I had to explain to them that for the next 3 to 4 days, they were actually exposing myself and my family to the toxins left behind from the previous smoker. And when I told them it was third-hand smoke, I had to explain it to them, and they had to go and look it up. It was amazing.
Dr. Presser gives his advice to be aware of these dangers.
Just like we want to increase awareness about lung cancer, since it is the #1 cancer killer, not just in the United States, but in the world, we also want to continue to elevate education and make people aware of secondhand smoke and now third-hand smoke.
Coming next, do you have a persistent cough? A cough may mean something serious. For a consultation with Dr. Presser, call 760-424-8224. A cough can be very annoying and sometimes very uncomfortable. A cough is the most common reason for visiting a primary care physician in the United States. Thoracic surgeon and best-selling author Dr. Eric Presser tells us the possible reasons for a cough and when someone should get it medically evaluated.
Many different things can cause a cough. The most common would be the common cold. And usually when we talk about cough, we talk about acute, which means it's about 3 weeks or less, subacute, 3 to 8 weeks, and then chronic, which is after 2 months of having a cough that just doesn't go away. So most of the time, the cough that we get is from something that comes and goes. Common cold, seasonal allergies, your lungs are irritated by the pollutants in the air, being around people who smoke, starting to smoke, starting to vape. Anything that can irritate the lungs and the airways can cause a cough. When we talk about the cough that stays, or lingers, if you will, that's when we should start to be concerned. That's when we should start to be proactive. Let's try to figure out why we have that chronic cough. Now, most of the time, the chronic cough is caused by acid reflux, and you need a good workup to make sure that you are not regurgitating acid into your system, if you will, that's causing irritation, causing you to cough. There are also types of medications, like ACE inhibitors. But if you're on an ACE inhibitor, about 10 to 20% of patients that take ACE inhibitors can develop a cough. That's a lot. So when you're dealing with cough, you have to first try to identify the cause. Now, the problem with lung cancer is that you can only identify the cause usually when you've coughed up blood or you have a cough that doesn't go away. And that's when you really need to probe a little further. Maybe insist on getting a chest x-ray from your primary care physician, or if you go into the emergency room, they might do a CAT scan of your chest. And that's where the lung cancer screening aspect that I mentioned in my book, The Empowering Guide to Lung Cancer, comes in. When I first started writing my book, lung cancer screening wasn't even part of our society. Now, If you're between the ages of 55 and 79 and you smoked a pack of cigarettes a day for 30 years or 2 packs a day for 15 years, you should get a screening low-dose CAT scan of your chest, and that is as per Medicare guidelines. So because these are now national guidelines, they are covered not just by Medicare, but all insurance companies. The bottom line is if you do have a cough that doesn't go away, don't ignore it. It's better to know than to not know.
For a consultation with Dr. Presser, call 760-424-8224. It's never fun coming down with the flu, but for some populations, it can be deadly. Over 80,000 Americans died of the flu last year, the highest toll in years. Thoracic surgeon Dr. Eric Presser discusses who is more at risk for complications from the flu.
The flu is caused by a virus, which, unlike bacterial infections, antibiotics cannot treat it. And the flu can cause severe symptoms: fever, chills, sore throat, runny nose, pneumonias, cough. It is more detrimental in young children, the elderly, and people who have chronic diseases. For example, smokers are much more prone to having the flu or getting upper respiratory infections and not being able to kick the infection, if you will. Most people who get the flu should have it out of their system in about 4 to 7 days. The cough can linger for about 2 weeks. We have to make sure, especially if we fall into those high-risk categories, we have to make sure that we see our physician. We have to make sure that we go to the doctor, that we go to the hospital, that we don't just blow it off the way we used to when we were younger. Because as you get older, unfortunately, we don't fight disease the way we used to. Our body is more immunocompromised, and yet which makes us more prone to infections like the flu and its detrimental effects.
It's important to get the flu shot every year.
The World Health Organization and the CDC absolutely recommend flu shots in the high-risk groups, which consist of children, the elderly, and people who have chronic diseases. As a healthcare provider, I get the flu shot every year because I know I'm going to come in contact to many people. We don't know if some of them have the flu, some of them don't. A lot of people that are in the hospital now are tested for the flu, and we try to give them medicines to decrease the symptoms. But if you look up the literature, many people will even argue that the medicine, the antiviral medication that they receive, the risks are worse than the benefits because some of the studies show that the symptoms are only decreased by a day or half a day.
Dr. Presser gives some tips if you do get the flu.
When you have the flu, you need to support your body. You need to drink plenty of fluids. You need to take Tylenol, for example, if you have a fever. You need to get plenty of rest, and of course, some chicken soup won't hurt. But the bottom line is, there's really no actual cure for the flu. It's just trying to give your body what it needs, which is the rest and the medicine, for example, to help you feel better.
Dr. Presser reveals some tips to help avoid getting the flu.
You don't want to touch surfaces that someone else has either coughed or sneezed or touched their mouth and then touched the surface. So constant washing of the hands is definitely a preventative measure. Wearing masks. You know, I don't think anyone is crazy anymore when they travel or when you go on an airplane and all these people are wearing masks. It has shown to decrease the risk of catching not just the flu, but other diseases that other people have and can give to people when they sneeze or cough. The biggest thing is the flu shot, that if you are in the high-risk group, which means if you're elderly or a child or a healthcare professional, that you get a flu shot once a year to help decrease the risk of getting the flu.
Coming up next, if you've ever smoked, it's crucial that you get a screening for lung cancer. For a consultation with Dr. Presser, call 760-424-8224. Vaping is becoming popular, but is it safer than smoking cigarettes? Thoracic surgeon and author of An Empowering Guide to Lung Cancer, Dr. Eric Presser, tells us about the increasing popularity and the possible risks of vaping.
Vaping is when you heat up a liquid or a solid, creating a vapor that you can inhale. And the reason why it's so big right now is because many teenagers are vaping because they think it's cool. In the news now, a lot of people are comparing smoking to vaping. Now with smoking, everyone knows that you use a flame or you use combustion and you create smoke. Now there are many toxins in that smoke that are very harmful to your health. The problem with vaping is that the verdict is still out on the long-term effects. With vaping, you can actually get the nicotine that you want or that you crave. You actually get the oral fixation of the device, whether it's an e-cigarette or a Juul, that you actually put into your mouth. But more importantly, by taking away the combustion, you're actually taking away most of the toxins in the smoke that are very harmful. The reason why that's important is because we still know that there are toxins in the byproducts of the vapor, but we don't know what the long-term effects are.
Dr. Presser advises no smoking of anything, but he does recommend vaping for one group of people.
I don't tell people to start to vape ever, because as a thoracic surgeon, the irritation and the inflammation that you cause by inhaling any toxic substance into your lungs is bad. I don't care what the literature says. I don't care what the short-term or the long-term effects are. That's common sense. I would never tell someone to start smoking. I would never tell someone to start vaping, okay? But I have started to use it with my patients as a crutch, if you will, to try to go from smoking to vaping and eventually to quit. What's bothering me is all of the hype and all of the social media surrounding vaping, calling it safe. It's far from safe.
The danger of cigarette smoking is real. Is this also true of vaping?
In my book, An Empowering Guide to Lung Cancer, obviously I focus on the cause and effect of cigarettes and lung cancer. I can clearly tell someone that 1 in 6 smokers will get lung cancer, and smokers live 14 years less than non-smokers. The problem right now is that we don't have enough information to give the statistics, but we do know that vaping causes extreme inflammation leading to cough, upper respiratory symptoms, and it's detrimental to your health, your lung health, which is what I also mention in my book. My best advice is to never start smoking, never start vaping, never put anything into your lungs except clean air.
Vaping and juuling among teenagers have reached epidemic proportions, according to the FDA. Dr. Eric Presser, a thoracic surgeon and author of An Empowering Guide to Lung Cancer, explains what Juul is and the possible health consequences that are being studied.
When we talk about juuling and vaping, we're actually talking about the device that is used to vape. That's what a Juul is. And it's actually a small device that looks like a flash drive, which allows children and teenagers to bring it out in the open, right in the middle of class sometimes, take a hit, and the vapor that they expel is odorless and colorless sometimes, and it goes away right away. So they're literally vaping right in front of their teacher, right in front of their fellow students, right in the classrooms. And that's why it's become such a new problem that we are seeing nowadays. You have a new generation that's being addicted to nicotine. Just like they glamorized cigarettes way back when, and now we're at a point where most of these teenagers or even young adults will never touch a cigarette. They think it's gross. But if you ask them about vaping, they will tell you, oh sure, no big deal. It's as if they don't understand the detrimental effects. What I try to educate people on is the fact that every time you inhale anything into your lungs, you're creating an inflammatory response. What the vaping is doing is it's actually heating up the liquid substance. And in this case, we do not know what the long-term effects are, but we do know that it causes an inflammatory response. And most importantly, we do know that we are giving the new generation the nicotine, which is what makes them come back for more.
The scope of the problem is enormous.
They actually say that millions of teenagers have tried vaping And when we talk about juuling, it's just a different device that utilizes the same concept, where you heat up a liquid substance and you get your nicotine fix. And if you ever drive by a car and you see a big cloud of smoke, most likely that comes from someone who's vaping. Now, what I tell all of my patients who are smokers is that they should try it, because it actually does give them the nicotine and it gives them the oral fixation. And both of these are what smokers crave. And combusting a cigarette is much more detrimental to someone's health than vaping. Vaping was actually made to help someone quit smoking. So vaping should only be utilized if you're going to use it as a stepping stone or a crutch to try to quit smoking. Almost on a daily basis, I get the question of whether or not they should smoke or vape cannabis or marijuana. Whenever someone comes into my office and I ask them about marijuana smoking, because it is legal now here in California, I always tell them that if they are combusting a marijuana cigarette or a joint, that they should try to vape it instead. They look at me funny, but I then explain to them that there are electron micrographs that actually show that when you vape cannabis, it actually leaves behind a lot of the garbage that you don't want to inhale into your body. The example I give anybody is when you go to a campfire. You cannot put your face over the actual campfire, and there's nothing more organic than that. You have a log that you found in the forest and you have fire. But because the fire is combusting everything in that log, you're breathing in everything. By vaping cannabis, you're actually leaving behind some of the garbage, some of the dirt, if you will, and it actually gives you a cleaner high or a cleaner way of delivery. Now, it doesn't mean that I am promoting that anyone should be smoking anything, because it does create and cause the inflammatory response. But if you're going to, then why not do it to the best of your ability? And beyond that, I always tell them, why don't they try edibles and oils? Because obviously with edibles and oils, you're not creating that inflammatory response. You're not inhaling anything that's going to cause or be detrimental to lung health. I will tell everyone the same thing. You should not be inhaling anything into your lungs. And nowadays, we need much more research on cannabis, because there is a lot more to it than just THC and doing it for recreational use to get high. The cause and effect of the CBD and the cannabinoids that we now know are going to open up a tremendous amount of education and research in the field of medicine, and hopefully it will help take care of a lot of the diseases that we don't have a cure for, or at least we cannot control the symptoms of, starting with chronic pain and ending with diseases like muscular dystrophy, epilepsy, and so on and so forth.
For a consultation with Dr. Presser, call 760-424-8224.